Our sciatica treatment, this is important, scientifically proven to eliminate the need for surgery, injections, and medicine, including opioids and anti-inflammatories, non-steroidal. We've done studies. We've identified that our treatment is the best for sciatica. Why? Because we treat the disc. It's a disc-related problem that requires a disc-related treatment. We're the only ones who do that. We've done 4 scientific studies that have validated this. 26 years, 26,000 patients, over 500,000 treatments, 8 scientific studies that validate that we have the ability to solve the problem in the disc. PubMed.gov. It's the government database for peer-reviewed scientific studies. It's where you research on the best way to solve problems for healthcare. Okay? Google's very good, but if you look for the truth, you have to go to the science. It's been published. Why do we do this? Because I've had serious problems. I had a severely degenerated disc. I had stenosis. I had sciatica. I found a way out. There are things that you can do. Oh, by the way, if you're interested in finding out more about what you can do, below in the description, we're going to have some links for the nutritional supplements that we use. Absolutely the best on the planet. Developed and discovered by a Harvard research professor for Harvard Medical School. Very, 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 very powerful, very, very, very effective. There's a routine that you can do if you have sciatica and a herniated disc, but if you do it every day, you can take the pressure off the disc. So we'll have those in the links below. But again, this is something that I lived, and we've developed a way out, and now our patients have the ability to get better. We do it in our clinics, and we can do it where you're at home. Okay, if you're at home, it just takes a little bit longer. It takes more effort. When we do it to you, it's easier, but you can also get the same benefit by doing this at home. But the key to what we do is we solve the problem in the disc. 24 vertebrae between the head and the hips. The vertebrae are the bones. In between each bone, there's a disc. The disc allows for motion. Inside the spine is the spinal cord. Now it's through the opening where the nerve exits off the spinal cord, where very often the nerves get pinched. And when they get pinched, it'll start to cause you a great deal of stress. I have barking dogs. And that stress will start to aggravate the nerve. Okay? That nerve exits the spine, and as it exits the spine, the pain goes down the leg when it is pinched. It's a serious, serious problem. Okay? The key to what we do is solving the problem in the disc. The disc is a lot like a jelly donut in the sense that the outside of the disc, there's a thick material. The jelly can start to move. As the jelly starts to move, that's when you start to aggravate the disc. So the key to solving the problem with sciatica is taking the pressure off the disc. Again, outer portion is the annulus, inner portion is the nucleus. Nucleus starts to move. As it starts to move, you'll start to aggravate the disc. It's the way you bend, it's the way you lift, it's the way you sit, it's the way you get out of bed, it's the way you do your dishes, it's the way you brush your teeth, it's the way you get out of your car. Okay, we have problems in our spines because we sit all day long at work, and sitting forces the nucleus out. As the nucleus starts to move out, you'll develop a bulging disc. And then over time, you'll develop a herniated disc, and sometimes the disc will tear all the way through to the outside and start to pinch the nerve as it goes down the leg. Also, what happens is that disc can start to get thinner. Healthy disc should look like this. As it gets thinner, what it's going to do is it's going to start to pinch the nerve. So you can also develop the degenerated disc that'll pinch the nerve. And as that disc degenerates, the space where the nerve comes out gets smaller, and the spinal canal gets smaller, and that's called stenosis. Stenosis will cause you problems with your nerves. Okay, but the key is if you free up that space where that disc is, you can free up the space where the nerve is. That is what we do. We have the ability to solve that. We heal the disc, and then we stabilize the spine. If you have pain that comes and goes and is not going away and you want to get rid of it, it's because you don't have stability in your spine. Stabilize, strengthen, add motion. That's the key to what we do. We treat the cause. We have the ability to get the nucleus and the disc to move back to the inside and free up that space. Okay, we take pressure off the disc. Massive hernia disc, went through the program. By the end of the program, the hernia disc was better. Same thing, massive hernia disc. By the end, it was better. We get healing in the disc. We did a study in 2007. And during that study, we identified that the herniated discs would go away. Before that, we didn't know it. They would physically go away, and we actually increased the flow of oxygen and nutrients. We did another study in 2016 that was published, and you can access that through pubmed.gov. I don't have it in here, but you can go to pubmed.gov to access that. Okay, 70 patients who had sciatica went through our program, and we compared 70 patients that went through physical therapy. The results were 10 times better. Why? Because physical therapy is very good for muscles, but it's not very good for the disc. The key to the sciatica is the problem in the disc. The key to back pain that's not going away is the problem in the disc. If you would like more information about the tips and the routine and the supplements, in the description below, you can access that. But these patients that went through the program, when they started with us, their pain was 7.5. When they finished with us, their pain was less than 1. Patients that went through physical therapy, they started physical therapy, the pain was 7.8. By the end of the physical therapy, it was 5.4. So they weren't a lot better. Carmelita had severe back trouble, ended up having a fusion before she saw us. Fusion didn't make her better, actually made her worse. It's called failed back surgery syndrome. The pain was so bad she tried to take her own life on multiple occasions because she couldn't live with the pain. It's a serious problem. Came into our program, went through the program, got better. She was taking opioids, taking the anti-inflammatories. When she started our treatment, by the end of her treatment, she was no longer taking the opioids or the anti-inflammatories. We have the ability to solve that. 1,200 patients entered our program. When they started, their back pain was an 8. When they finished, their back pain was a 1. 907 of those patients, this is a study that will be published this year, had sciatica. Half of them were taking narcotics and anti-inflammatories before they started. By the end of it, they were all off the opioids. We have the ability. And 26% of them had failed surgery before they saw us. Half of those had failed fusion. We have the ability to solve the problem. 70% of the patients that have sciatica, not our patients, but the general public, 70% of them in 1 year will get better, but 30% will not. And of those 30%, a third of those will end up getting surgery. You can avoid the need for surgery. You can avoid the opioids. You can avoid the injections. We have the ability to solve this problem. Again, there are nutritional supplements you can take to help decrease the inflammatory process. It's called resolution of inflammation in the disc and in the nerves, which is why the pain doesn't go away, because of the inflammation. So you can go to the description below. You can like our page, like this video, subscribe, share, and comment. If you want to make an appointment, you call 844-577-7329. You don't have to live with the back pain. We can solve it. All right, that's it. Have a good day. Be very careful, and we can solve it.